Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by our Metro Health Director, Claude Jacob, and this is our COVID-19 update for the San Antonio community. Tonight we are reporting 953 new cases of COVID-19, so our 7-day moving average is now 983. We're very thankful that has now dipped below 1,000. Want to keep that going in the right direction. Sadly, we are reporting 21 new deaths this evening. We've lost a total of 4,017 friends, neighbors, loved ones to this virus. These are folks that we miss dearly, and so please keep their friends and family in your prayers this evening. Over in our hospitals, we're starting to see a little bit of light through the clouds. 1,159 patients in area hospitals tonight with COVID-19. There were 143 new admissions in the last 24 hours, 365 patients in ICU, and 260 on ventilators. These numbers are still quite high, but they are now trending in the right direction. Please note, 85% of patients in area hospitals are unvaccinated, and tonight there are 25 patients who are children with COVID-19 in area hospitals. In terms of vaccinations, at this time there are 1.1 million Bexar County residents who are fully vaccinated, and 1.4 million residents have received at least one dose. We still have quite a ways to go to reach herd immunity, nowhere near that mark, so we will need to continue to get those vaccination numbers up. If you're eligible, go get a vaccine. During today's council session, I do want to note City Council approved the purchase of $1 million worth of gift cards from HEB for Metro Health's COVID-19 vaccination incentive program. And Claude Jacob is here tonight to talk a little bit about that before we go to questions. Metro Health did receive approval to use federal money from the Immunizations COVID-19 Round 4 grant fund. And so the City of San Antonio will offer those gift cards starting at the end of September as parts of an effort to increase our vaccination numbers here in Bexar County. So, again, Claude will go over that in just a moment. But first, let me turn it over to Judge Wolff.
Yeah, I'm getting more confident we're heading in the right direction. And we dropped another 35 yesterday in the hospital. If you begin to look at that line, it's sort of following when we've had other surges. It's starting to follow it down on the hospitals. I think a good deal of the credit should go to the fusion center that we've got. I think we're around 3,000 people now that have gone out there and had the infusion of Regeneron or the other monoclonal antibodies that we're offering there, and that's really helping hold that hospital rate down. I've talked to several people that got it, and within a day or two, they're feeling real chipper after what they've had to go through. The other thing that makes it feel like we're really in the right direction, I think we've cracked the 70% now of people that have had both doses of the vaccine, which is good. I think we're at 70.4, something like that. And then the other good sign is that President Biden today has made some announcement that people with over 100 workers are going to be required to be vaccinated. Roughly 17 million workers at healthcare facilities that receive Medicaid or Medicare will have to get vaccinated. It still amazes me that there's, 10, 20% of healthcare workers that have not been vaccinated. And I think according to the CDC figures now, we've lost 1,700 healthcare workers that have perished because of COVID over the last couple of years. So it just seems like all the things are kind of coming together, and hopefully we're going to be getting out of this.
And we hope we do, and we need to continue our efforts to move that in the right direction. So thank you very much, Judge. Before we go to questions, I'm going to turn it over to Dr. Jacob to talk a little bit about the vaccination incentive program about to be unveiled. Dr. Jacob.
Thank you, Mayor. So earlier today, the City Council approved the HEB gift card incentive program. Again, thanks to the City Council, the City Manager, and our incredible staff for pulling this off. Our team expects to roll out this incentive program later this month, and we issued a press release earlier today. In broad strokes, individuals will be eligible for a gift card only after they receive their one dose of J&J vaccine or second dose of Pfizer or Moderna at a Metro Health vaccination site only. Again, individuals who are already fully vaccinated are not eligible to receive a gift card. Also, those individuals are eligible for a gift card only if they started their vaccination series after July 31st. Keep in mind that our team will purchase 10,000 HEB gift cards valued at $100 each. We thank our funders at the CDC, the Centers for Disease Control and Prevention, for augmenting our program. We are finalizing the appropriate procedures to ensure that we meet the COSA cash handling requirements. Our staff are attending a required training next week, and we expect this rollout to occur later in the month, now that the City Council has approved this incentive program. We will be receiving the gift cards in installments, and if we do not use the cards, we expect that we'll be able to return them. Keep in mind that previously the City of San Antonio has offered other incentives, including a partnership in May with Six Flags Fiesta Texas to provide 20,000 complimentary tickets to the theme park, as well as a partnership with the Spurs Sports and Entertainment in July to host vaccine pop-up clinics at AT&T Center and the Toyota Field, where we gave away 2 Spurs 10-game season packages. Again, we really appreciate getting the word out. This is an opportunity to take advantage of some federal funding that augments our programs, and we thank the City Council and City Manager and our incredible team for helping to roll this out.
Thanks, Dr. Jacob. And finally, part of our formula for success here in getting these numbers to go in the right direction is getting folks tested if they have symptoms. To finding testing location, visit covid19.sanantonio.gov, or you can call 311 and hit option 8. In the meantime, please wear a mask and get vaccinated. Also, for you UTSA football fans, we're excited about their early success. If you're attending the UTSA home opener this weekend at the Alamo Dome, note that there will be a vaccine clinic available there from 4:30 p.m. to 9 o'clock p.m. Again, Pfizer and Johnson & Johnson vaccines will be available. And so we encourage you to go out and get vaccinated if you have not already. Do it for yourself, do it for your family, and do it for San Antonio. You can get the latest on COVID-19 by texting COSAGov to 55000 or by going to the website covid19.sanantonio.gov. The judge, myself, and Dr. Jacob are available for questions.
Dallas recently confirmed a case of the new Mu variant. Have any Mu variant cases been confirmed in Bexar County?
Thank you for the question. We have not confirmed any cases of the Mu variant as of yet. Just know that there typically is a lag time with getting those confirmations from our area labs and from the state. But we remain vigilant. Again, we heard about the case in Dallas County, and we'll report out as soon as we hear any cases here in Bexar County.
Claude, are there any concerns about fake vaccine cards, and how can those cards be verified to make sure that they're real?
Yeah, that's a challenge in terms of the fraudulent vaccination cards. Just know that we've heard anecdotally, sadly, just know that it is illegal to have these cards used out and about, whether it's residents or students or whomever. So we're working with our state level partners, but we've just heard anecdotally. So we're just keeping an eye out in general for any of these cards that may be presented to us.
Have you seen any here or heard of any here in Bexar County?
Sorry, I didn't catch. Could you repeat the question?
Have you heard of any here in Bexar County?
I myself personally have not heard, but that doesn't mean that there haven't been any cases, and so we can go back and verify if there have been any reports as of date.
Mayor, we have surpassed 4,000 deaths because of COVID-19 in the last 18 months. Can you talk more about those who may be disproportionately affected, or just the impact that it's had on our community? I think that we're kind of numb because so many folks are dying from this, but it's, you know, you see it, yeah.
The toll has been acute in our community, and I think you can look at our social vulnerability index, some of the underlying conditions that are present in our community to understand why. But the toll on individual families has been too much to measure. I have a colleague who lost 7 family members. So, you know, we talk about where we're at with numbers every night on this program, and we're quick to remind folks every single one of those numbers is a mother, a father, a grandmother, someone who's lost, who is dearly missed. And so, you know, 4,000 people in our community is a lot. One is a lot to any family, and we just want people to remember that. And, you know, when it comes to what we need to do, the minor inconveniences that we go through to protect maybe one life from being lost, it puts it in proper perspective. Some of the bickering that's going on about wearing masks and things is a small ask if you talk to one of the families that have lost a loved one.
You know, so many of these recent deaths were totally unnecessary. People who refuse to get vaccinated for whatever reason, 99 point some odd percent of them are the ones that are dying. I just heard a story today from a local health care entity in San Antonio. A nurse didn't get her vaccination because her husband, insisted that she not do it. They both got COVID, and her husband dies, and I think they were only 40 some odd years old. So it was totally unnecessary, and that's what's so sad about what's happening now. Before we had vaccines, it was a different story, but now that we've had them since January, we've been taking vaccines, and still that many people didn't take it and then ended up in the hospital or ended up dying. Just totally unnecessary.
Judge, you hit on a big talker for today, which is the vaccine mandates that were rolled out by the president. Obviously, a lot of questions here locally in San Antonio from people, companies, but your reaction to that, obviously you're saying, I think we're heading in the right direction with this fight.
I think what you're going to see is you're going to see more and more companies require vaccinations. I think United Airlines, I believe it was, is requiring it. They're saying either get it or take the weekly COVID test. We've just got the total wrong message out of Austin. They've done everything to stop companies from doing that. But again, I'm so glad what President Biden did announce today about the requirements to get vaccinated. We've got to get vaccinated if we really want to get out of this thing permanently.
Dr. Jacob, I know we always want to stress that the vast majority of people in hospitals for COVID are unvaccinated. Same thing with deaths. Do we know how many in Bexar County, how many people have died that have been vaccinated?
The question is how many people have in Bexar County that have died that have been vaccinated. So just know that we looked at comparative data during a certain period where we identified 6 individuals who were fully vaccinated who passed away due to COVID, and our presumption is that they had pre-existing conditions compared to over 2,000 individuals who were not vaccinated. So just, again, it makes the point that the value of being vaccinated, the importance of getting vaccinated, we know that this is really a pandemic amongst those who are not vaccinated. So that's what we can share with you now. But just know that the take-home message, which is why we're really excited about this incentive program, is to make it easier for folks to make that decision in order to be vaccinated.
And as far as the other incentive programs, were y'all able to keep track of how many came out as a result of those?
So I can tell you in July with the Spurs package, over 2 weekends, we had 288 individuals who showed up in order to participate in that drawing. Again, even in terms of the Six Flags, so we had over 20,000 complimentary tickets that were provided, but just know that we make every effort to at least incentivize and make it easier for folks to get vaccinated. So that's what we can share with you now, and we'll see and we'll report back in terms of the rollout of the HEB gift cards, which will be happening later this month.
And have all 20,000 Six Flag tickets been claimed?
I can find out how many of those have been claimed. I can tell you about the Spurs package, but I can find out about the Six Flags tickets.
Dr. Jacob, are there any plans to give incentives to those who have already been vaccinated?
Just know that the funding that we receive for the rollout of the HEB gift cards, the requirements, at least from the CDC, is that this is an incentive for those who have been unvaccinated and who are eligible after July 31st. So we don't have an incentive program right now for those who have already been vaccinated.
Judge Wolff or Mayor, if you had a chance to listen to the president's speech, was there anything that you wish the president would have done more of or gone further with when it regards to his plan?
I haven't been able to listen. It was in the middle of our workday, so I plan to listen to the speech tonight. But my understanding is that he leaned in where we need additional pressure on folks to do what they need to do to protect others. Listening to the question that Claude just received on can we incentivize folks who have already gotten the vaccine? It reminds me of the parable of the prodigal son. I mean, we want people to go get vaccinated because it's the right thing to do, and they should feel good knowing that. We have to, unfortunately, place a little bit more resource and emphasis on folks who are just sitting it out because they are at risk themselves, and they're placing the entire community and country at risk. But it is in our best interest to go reach those folks too and bring them in.
I think he's taking some aggressive steps today, and glad he did. I think we've had over 3,800, incidents on airlines by people who get angry because you have to wear a mask, and they attack the others that are working for the airlines. So he's got strong on that too, doubling the federal fines for airline passengers that refuse to wear a mask. So he's taken some pretty strong action across the board, I believe.
Having talked to business leaders here in the community, do you think that there will be any issues with major companies maybe enforcing these vaccination mandates?
I've talked to a number of businesses who have already put their own mandates for employees in place. And I think with the president's action today, you're going to see more businesses do that because now they have the force of the president's word behind their actions, and they know it's only going to protect themselves and their customers.
You got to remember, the governor of our state did everything he could possibly can to stop companies from requiring vaccinations or wearing face masks. So coming in with the federal incentive and mandate, hopefully that'll overcome some of the stupid decisions made by the governor and by the state.
We did talk with the governor's office a little earlier, and they said to us that the office of the attorney general has already been contacted to halt the power grab. If there were to be a stay of any kind, where does Bexar County go from there?
If there's a stay on which part?
The vaccine mandate.
On companies 100 and over?
Correct.
Well, if there's a stay, I mean, we wouldn't be able to implement, or we wouldn't be able to enforce it. But again, we'd be encouraging it. And I think the judges said it very clearly. The governor and the attorney general have done everything they can to step into the middle of mitigation efforts to combat the pandemic.
And just like the schools, I don't think we have the last week's numbers yet, but if I recall right, because he, refused to follow the mandates that we did on health, requiring masks and social distances. I think 74,000 school personnel have had COVID. I think it's close to 50 or 60,000 of kids too. All that was unnecessary also. Just, in my view, madness on their part.
Dr. Jacob, what documentation do people who got vaccinated after July 31st need to provide to receive their incentive?
So just like anything else, we encourage residents to get vaccinated. In terms of documentation, we'll be keeping track of date of birth. We'll be keeping track of, we'll be asking about zip codes. We are making sure that we have a voucher where we look at the dates of the doses that are going to be administered. But just at the end of the day, we are not asking for identification as much as it is just encouraging folks to come to the Metro-sponsored vaccination clinics. And if they are eligible, we'll make sure that they complete their vaccination series in order to be eligible for the $100 gift cards.
Do you have advice for someone who's been vaccinated but lost their vaccination card?
For now, I mean, they can contact our office and we can help them navigate. We know that there are different platforms and different systems in place. We have heard anecdotally of folks who either they're having a difficult time getting that information from their provider. So just to contact our agency and we'll try to help them navigate.
Dr. Jacob, I was wondering, is COVID now the leading cause of death in Bexar County? Can we say that quite confidently?
What we know is that this has been a colossal storm for folks. If you look at just the sheer numbers in terms of the number of cases, I mean, we're closing in on 300,000 reported cases of COVID over the course of the last 18 months. That's the Alamo Dome times 4. We heard the mayor talk about the 4,000 lives that have been lost here. So it is one of the leading causes of death. We'll verify whether it is the leading cause of death. And we know that this is exacerbating other conditions around heart disease, cancers, strokes. So just know that COVID has become an exacerbator, and we know that with confidence it is one of the leading causes of death over the course of the last year and a half.
That's all we have tonight. Thank you.
Thank you.